Welcome to HIPAA Basics, Privacy. As healthcare providers, we have always been called upon to maintain the privacy and confidential of a patient's health information. This is an ethical and legal obligation that we hold as nurses and as nursing students. Until recently, a patient's medical record was recorded and maintained primarily on paper and stored in the offices of physicians, hospitals, and other healthcare professionals. These records were kept safe in locked cabinets or closets. With the advent of computers and other electronic technology, we are now able to maintain electronic files that allows us more flexibility in communicating information between offices, hospitals, and clinics, as well as cutting down on the space requirements for storage. In addition, we are better able to track and analyze data that helps us to be more effective in providing care as well as in controlling cost. According to the American Health Information Management Association, AHIMA, an average of 150 people from nursing staff to x-ray technicians to billing clerks have access to patients' medical records during the course of a typical hospitalization. There are, however, concerns that the increase in electronic information result in a loss of privacy and confidentiality. Because so many people potentially have access to patient medical information now, we need to do more to ensure that the only people who do access the medical information are those who need to have access in order to provide care. The history of HIPAA. The federal government passed a law in 1996 that creates national standards to protect patients' medical records as well as other personal health information. This federal legislation is called the Health Information Portability and Accountability Act, HIPAA. HIPAA became effective on April 14, 2003. It sets for minimum requirements that facilities must follow to protect patients' health information. The key term associated with the privacy rules is protected health information, or PHI. It covers information that can be found in information used within this facility, verbal or written information, information stored on computer files, information stored in paper patient files, information shared with other healthcare providers, payers, or third parties. Failure to comply. Every healthcare organization is expected to develop policies and procedures to guide practices within their facility. Every person who provides care or assistance to patients in that facility is expected to understand and comply with the HIPAA regulations. Each team's members' work is important for patient care. At the same time, it is essential that all patients' health information be kept confidential. Organizations or individuals that violate the privacy rules are subject to monetary fines up to $250,000 and or civil or criminal charges up to 10 years in jail. Failure to comply may also hurt the reputation of the facility, put accreditation at risk, and result in costly lawsuits. The goal. The goal of the HIPAA privacy program is to protect confidential information from improper use or disclosure. What does this mean to you? Every agency must appoint a privacy officer, develop policies and procedures that guide HIPAA implementation, evaluation, and revision, and these should include actions taken for people who do not follow the directives, provide education on HIPAA and organizational policies and procedures, develop a process for handling privacy-related complaints, ensure no retaliation occurs against someone who reports potential violations in good faith, take appropriate action to minimize any harm that they may result from breach of privacy, and ensure processes are in place to demonstrate compliance with documentation and record keeping. Your responsibility: you must respect confidential information about patients and use information only to perform your role as a student nurse in that agency. It is your responsibility to be sure patient information is only given or disclosed to others who have a legal right to it. What information needs to be kept private? All information that identifies an individual is considered confidential. This includes but not limited to name, address, date of birth, phone, fax number, social security number, medical record number, and photographs. It also includes nursing and physician notes, as well as billing and other treatment records used during a patient's visit in the hospital or office. HIPAA guarantees several rights to patients: a right to privacy, a right to confidential use of their health information for their treatment, billing process, and other healthcare operations, such as quality improvement, right to access and amend their health information upon request, right to provide specific authorization for use of their health information other than for treatment, billing, and other healthcare operations, right to have their name withheld from our patient directories, right to request that information is not given out concerning their care to specific individuals, including the right to opt out of our patient directory, name not listed as being present in our facility other than for treatment, billing, and other healthcare operations, right to request that individuals are not told of their presence in our facilities. Every patient should have received a document called a notice and be asked to sign an authorization. This notice gives patients information about their rights, a description of how their PHI may be used by the facility, a comprehensive list of others to whom their information may be disclosed, and the notice must be given to the patient on the first treatment date or as soon as the practical in an emergency situation. An authorization is a form signed by the patient for the use and disclosure of specific PHI that are not related to treatment, payment, or healthcare operations. There are some uses and disclosures where an authorization is not required. When in doubt about what information is required to have a signed authorization release, ask. What you need to know is patients have the right to register complaints with federal agencies and with the facility if they feel their rights have been violated. Every facility has a privacy officer who is responsible for overseeing HIPAA implementation. If you are uncertain about what information may be given out, talk to your instructor or one of the nurses on the unit where you are assigned or contact the privacy officer. HIPAA's goal is to catch staff, patients' health information with those who do not need the information. True or false? The answer is false. The goal of the HIPAA is to protect confidential patient information from improper use or disclosure. If you see an apparent violation, you should report it to your instructor, who will immediately assist you in contacting the privacy officer. Some of the biggest threats to patient privacy is unintentional disclosure of information. This is discussed in a case where other patients or visitors may overhear, such as elevators, hallways, or cafeteria, leaving sensitive information out where patients or visitors can see it. Another threat to patient privacy is when a workforce member intentionally uses or discloses information in an unauthorized way. Copying information and taking it home, removing medical records from the health facility and giving them to others who have no legal right to them, deliberately sharing information with unauthorized persons, such as family members, friends, or news reporters, using confidential information and gossiping about patients, leaving a computer unattended after logging in to an application, and sharing passwords with others or leaving passwords around a computer. It is essential that everyone who provides care and services to patients be aware of what is going on in their surroundings to ensure that confidential information is only shared with those who need to know, and at a minimum level necessary to enable them to carry out duties and responsibilities safely, effectively, and efficiently. Always be aware of where you are, who is around you, and what information can be seen or heard. It may not be possible to ensure absolute privacy, but reasonable measures need to be taken to minimize the chance of incidental disclosures to others. Don't browse through a patient's chart or other files out of curiosity. Access only the portions of the medical record you need to perform your specific role as a student nurse. Review question. One of the privileges of working in healthcare is that we have access to our family and friends' health information so we can find out when they have an illness. True or false? The answer is false. We do not have the right to access anyone's health information, including family members, unless it is directly needed for the completion of your job responsibilities for a patient. If you accidentally see patient information that is not directly needed for you to perform your job, you cannot share that information with anyone else. Verify identity. Before you can release information about a patient, you must first confirm the identity identity of the persons requesting information about the patient, whether in person, by phone, or in writing. What methods can you use to verify identity? A photo ID and information that only the patient would know and which you can confirm, such as the patient's middle name. Security rules are privacy rules that identify what information is protected and defined when and how that information may be used or disclosed, and security rules. They apply to the PHI that is sent electronically from one location to another, and they identify steps to take the secure PHI that is in electronic format. They also apply to PHI that may be used or stored by the facility. There are 4 key parts which work together to protect PHI. These are physical security, technical security mechanisms, and administrative procedures. And these define the basic level of security that must be in place to comply with HIPAA. Electronic communication is a part of ensuring the privacy rule is to understand how information is stored, transmitted, and accessed by staff. Faxes, emails, and computer printouts may contain patient information. Take precautions to ensure that these types of communications get to their intended destination. As students, you will likely not be in the position to fax or email patient information to others. If you are placed in a situation where this becomes necessary, talk with your instructor about the proper procedure. Case scenario: Dr. Williams asked Sue, a nurse, to bring up his patient lab results on the computer screen. Dr. Williams looks around and does not see any other staff or visitors in the area. He asks Sue to turn the monitor so he can see the chart. There is no other person around the desk when the screen is turned towards him. When Dr. Williams is finished, Sue turns the screen back around, facing away from public view. Dr. Williams and Sue violated the patient's privacy by turning the screen and viewing the lab results. True or false? The answer is false. They took the time to examine their surroundings and made certain that no unauthorized individuals were near. Turning the screen and then returning it to a secure position is an acceptable practice. If visitors or others were present, the doctor would need to go behind the desk and view the screen. Paper communication. You will find during the clinical experiences that there are a lot of paper that contains confidential patient information. Make sure you keep this paper out of the public view. Do not leave documents where the public can easily access them, even accidentally. Many of you may use visitor lounges for conferences. Do not leave your papers or any medical record information where it can be seen by others. When documents containing patient information are no longer needed, shred them or dispose of them in designated containers. Case scenario. Julie is a nurse entering notes into a patient chart at the nurse's station where visitors come to ask questions. Jeff, another nurse, steps out of the patient's room and asks Julie for help. Julie leaves the patient chart open on the desk and then goes to assist Jeff in the patient's room. Question. Leaving the chart open on the desk when the nurse leaves the area is okay because she will be right back, and trying to find her place would take too much time. True or false? The answer is false. The best way to maintain patient confidentiality is to never leave records unattended in public places. Closing the chart is a good first step. In a non-emergency situation, return to the chart to its designated location before leaving the area. In an emergency situation, secure the chart using your professional judgment, then proceed to assist with the emergency. Verbal communication. Nursing is never practiced in isolation. It is a collaborative team operation. As a result, there are many times when you will need to discuss patient information with colleagues. In doing so, remember you must only discuss information relevant to the patient's care. Only include those involved in the patient's care, and select an area that is as private as possible, and check the surroundings to ensure no one will overhear confidential information who shouldn't. Case scenario. Jennifer, a nurse, and Tom, a physical therapist, are eating lunch together in a cafeteria. They begin discussing a patient that they are both treating. The cafeteria is crowded and others around them can hear them referring to the patient's name and other confidential information. Question: they are violating the patient's privacy in this situation. True or false? The answer is true. Never discuss a patient's health information in areas where there are others that don't need to know about it. If you need to discuss a patient's care with a coworker, speak softly in an area away from the public. Case scenario: an adult daughter of an elderly patient is presented in the room when his doctor enters to speak with the patient about test results. The patient introduces his daughter to the doctor and then asks the doctor if the test results are back. The doctor begins to explain the results to the patient. The doctor violated the patient's privacy by talking about the test results with the daughter present in the room. True or false? The answer is false. Since the patient asked about the results with his daughter in the room, the doctor can assume that it's appropriate to share the results at that time. Question: in a radiology waiting room, an X-ray technologist calls the next patient by name saying, "Jane Smith, we are ready for you to get your sonogram now." Question: the X-ray technologist violated the patient's privacy by calling out her name and tests to be performed. True or false? The answer is true. Employees in doctors' offices and waiting rooms are allowed to publicly call a patient's name. However, care should be taken to limit any other information communicated. The X-ray technologist should not have mentioned the test to be performed. Stating that the patient is having a sonogram is unacceptable. Jane Smith, we are ready for you now, is acceptable. Non-retaliation policy. There should also be a policy in place to safeguard the rights of a person who in good faith reports a privacy violation. Action should not be taken against anyone who in good faith exercises her or his rights, including filing a complaint, contacts or sends a complaint to the Department of Health and Human Services, testifies, assists, or participates in an investigation, compliance review, proceeding, or hearing, believes that an act or practice is against the law. The person reporting the violation must have a reason to believe that there is a problem and may not use or disclose PHI to address his or her concern. If you feel that there has been a privacy violation, inform your instructor, who will immediately assist you with contacting the privacy officer. Refer patients who have a privacy concern or complaint to the nurse in charge of the unit. To summarize, all health information that is specifically identifies an individual is considered confidential. Protecting the privacy of patient information is everybody's responsibility. Even though you are a student, you are an active part of the program. Use patient information only to perform your responsibilities as assigned. Beware, don't intentionally or unintentionally disclose patient information. Help others do the same. And if you suspect any privacy violations or concerns, notify your instructor, who will immediately assist you in contacting the privacy officer. We are HIPAA compliant. Are you? Thank you.